Welcome to Next to Madison, a podcast to help you live your best life.
Welcome back to another exciting episode of Next to Madison. This is episode 175, and on today's episode, we are talking titties. Yes, that is correct. We are talking boobies, titties, fun bags, whatever you want to call them these days. But my guest today on this episode is an amazing, very accomplished plastic surgeon who specializes in breast augmentation. So she is here to give us all the whole lowdown on what kind of goes into this. I was going to ask her about the risk, how they've evolved, why some women are getting sick from them, and what you can do if you're thinking about getting this procedure to keep yourself safe, and if this procedure is even right for you. So we're going to get into all that good stuff right after this quick announcement. Again, I'm your host, Madison Malloy, and I am thankful that you are here, and this will be a fun episode. So we'll see you in a bit with our guest.
This episode is brought to you by Balance 7. Balance 7 is a concentrated alkaline with a pH of 11 plus. I didn't realize that acidosis is responsible for almost every infectious disease in our world today. With COVID-19 and the world opening back up, I started taking Balance 7, and after 3 days of taking it, I feel better, I have more energy, my focus is better, I think clearer. This supplement is amazing. Thanks, Dr. Noristani, for the recommendation. And all Next to Madison listeners are able to try it today by visiting balance7.com and enter code word Madison for a complimentary gift and free shipping.
Welcome back. We are with our amazing guest on this episode of Next to Madison. I'd like to welcome Dr. Anna Steve. How are you?
I'm good, thanks. How are you?
I am doing great. I'm so excited about this episode because I think this is an area that a lot of people know about, but they don't know like the ins and outs of the industry. I have fake tits. I'll admit that. But I don't know when I need to get them replaced. So before we get into all that stuff, tell us about how you kind of gotten to this area of plastic surgery.
Totally. So my journey started many years ago. I kind of knew I wanted to do something where I was working with people, and I had a background in sports. So I thought I might want to be a physiotherapist. Long story short, I got to spend some time in the operating room, and I got to spend some time with a plastic surgeon in high school, actually. And I was just baffled by the immediacy of the transformations you could have with plastic surgery.
Yeah.
And so that was kind of my starting point for plastic surgery. And, fast forward through medical school, really confirmed that it was the one surgical subspecialty where you're really you're taking someone who has specific concerns, and you're improving their form and function, you're improving their aesthetic. And in surgery, you're so often taking something away. So plastic surgery is really unique in that sense. It's like one of the only surgical specialties that has that ability. Okay. And it's also super unique. And what I love about it is that, each operation is different, each individual is different. So you sort of have a tool set that's available to you, and you use your tool set and your palette to sort of make an operation that's right for each unique patient. And that's really unique to plastic surgery as well, I think.
Yeah.
That's kind of how I found my groove in plastic surgery and why I love about it so much. Okay. And that's kind of led me to where I am now. So breast surgery is similar. Each patient has unique concerns and unique considerations. And we often say in breast surgery that, maybe even within an individual, the breasts are sisters and not twins, and hopefully not cousins.
Yeah.
But from that circumstance, we always strive to achieve symmetry in plastic surgery as well. So there's some nuances to that specific to breast surgery that makes it a fun and unique challenge each time.
Yeah, because just like everybody has a foot that's slightly bigger, everybody has a tit that's slightly bigger.
Totally.
So when you do the implants, you obviously get them even, correct?
Yeah, that's always the goal. Symmetry is like a super important part of plastic surgery. And no one's perfectly symmetric, but we always strive for excellence.
Yeah. And how do you know when somebody comes to you and they say, okay, I want this size, that it's the right size for them? Because I'm sure that you get some people in there that are like, I want just cartoon boobs, I'm going to call them. Like
Well,
too
I
big.
think
And you're like, no, 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 no.
what I'm seeing is trends are really changing. So specifically in New York, women are requesting smaller and smaller implants, natural looks. I think fashion is really dictating that. And a lot of women come in saying, you know what, I want to fit my D&G, and I can't do that with my current implant size. So I want to go down in size from
They
where
want
I
a
was.
what?
They want to go down in size.
What's a DNG?
Oh, Dolce and Gabbana.
Oh, okay. So Dolce and Gabbana is made for like small breast
Yeah.
women.
Or, fashion in general is really starting to dictate, I find, the type of implants and the size that women are requesting. So, but back
Interesting.
to your back to your question about how we choose a size, I think in general, there's a very narrow range of implants that are a good fit for each individual. And so that's dictated by your breast dimensions. And then the next conversation that I have with people is just using a few words to describe the type of look that they're going for. Because I think there's a really big difference between someone who describes a full augmented look to a natural, elegant look. And that really helps me choose the profile of the implant. So the profile is how much they project,
Okay.
and sort of the difference between a really full looking shape and something slightly more natural looking is really dictated more by the profile than the volume. So
Okay.
that's usually the next conversation that I have with women when we're trying to find the right size for them. And then the third component that really helps calibrate and make sure that we're using the same language to discuss the same type of look is to have them provide some inspiration photos as well. So the inspiration photos are good because they give a visual image. Plastic surgery is very visual. And I think it also helps set realistic expectations. So if someone brings an inspiration photo of someone who looks very similar to their frame and similar to their own body type, that's very helpful. But if someone
Yeah.
brings a inspiration photo of a woman who looks very different in terms of their build, then it sort of spurs a conversation about the expectations and, the different sort of body type that you might have starting out with that will affect your overall size and shape. So those are the three components of where we start out with choosing implant size. A lot of people get really stuck on the volume, and the volume can look very different on women of different frames. So
Yeah.
a 200cc implant looks very different on a 160-pound woman than it does on a 100-pound woman. And weight isn't the only factor either. The chest width is really important, as well as height. And then the other thing that I find makes a big difference is women tend to have one of three types of breasts. So some women generally are higher breasted, some sit kind of in the middle, and some women have a very low breast footprint. So the
Okay.
footprint is where the breasts sort of sit on the chest. And so that plays a role as well into how large an implant will look on your own body type. So those are all important things to think about when you're thinking about what the right implant is for you.
And do you guys still do the rice test where you put the amount of rice in the pantyhose?
I don't use that technique, but I have seen that throughout my training. And I think one of the other things that is helpful for patients is we have a wide range of implants at our office that you can actually just, feel put in your own bra. It's imperfect, and
Yeah.
that will overestimate how large you'll look with that size of implant. But it does give women some sense of insight as to what the different sizes actually mean, and also an idea of what the different profiles look like. I find it's very helpful for people to have an implant that has the same volume but two different profiles in their hand to really understand what that means in terms of the shape.
Okay. And then let's talk about the differences. There's saline and then there's silicone. Is there something else?
Yeah, so those are the two main types. The saline implants also have a silicone shell. And then the silicone implants are the ones that are commonly referred to as the gummy bear style implants these days. So there are differences between the two. Silicone implants, they're called like a form stable implant. The gummy bear style texture means that if they rupture or puncture, generally the silicone doesn't spill, it stays in one place.
Okay.
Unlike that, the saline implants, if they rupture or spill, they deflate.
Yeah.
So it's obvious. Generally, for any given size of implant, the saline implants will be heavier than the silicone alternatives.
Okay.
And the saline implants have a higher risk of a rippling deformity. So the silicone implants, because they're form stable, or that gummy bear style implant, they tend to have less rippling or visibility under the skin.
And are they softer to the touch?
They do feel a little bit more natural, yeah.
Okay, gotcha. Now let's talk about, because when breast augmentation first started, you started hearing a lot of negative things about silicone and how it was causing a lot of health issues. How has this industry addressed that, and are they safer now?
Yeah, so the implants are a very well studied device now. They have a long history within the FDA and medicine. Over time, there have been advances that make them safer and safer. And we're also seeing that with time and previous history, when there were some problems, we've developed registries that allow us to study the implants over time to be able to identify if there are any problems with the current technologies that we're using. So in terms of how things have changed, the implants have become much more durable, much safer. They're really well-studied devices. And the studies are always ongoing. So we're always updating our knowledge of the potential risks and also the potential benefits of the alternatives we have available to us today, so we can keep our patients most informed in making decisions that are safe for them.
Yeah, absolutely. So let's talk about the scarring, because when you go in with the traditional silicone, I have friends that, have gotten breast implants, the silicone method. The scars are pretty crazy.
So the scars actually can be placed in a variety of different ways. So the technique that I like to use is through the breast fold. So it's well hidden. And generally, I like to keep that incision between 3 centimeters and 4 centimeters. There's some new technologies that help us actually insert the silicone implants through very small incisions. And I use a technique called a Keller funnel. So you use a non-touch technique to insert the implant through that small incision. And it sort of almost looks like when you're putting icing on a cake. The funnel that you use to put icing on a cake, it's very similar, but of course it's a medical grade funnel. And so that really helps place those silicone implants through the small incision.
Interesting. Okay. And so, because when I had mine done, I had the saline and they put them through my belly button. Are they still doing that?
It's less common, but the benefit of saline implants is just that you can put them through also a very small incision and then inflate the saline implant once it's already in the correct pocket.
Yeah. So I like that because I have no scars,
Mm-hmm.
which was kind of cool.
Very cool.
So what about there's the implant can be placed under the muscle or over the muscle. Why would somebody like what are the differences and how does somebody choose which method is right for them?
So I place most implants below the muscle. Um, in fact, it's actually what we call a dual plane technique, but primarily under the muscle. And the reason I do that is the rates of something called capsular contracture are lower. And so when the implant goes in to your body forms a scar around the implant, just like you form scar on the outside. That's a normal part of the process. And in some people, that scar can become tight. And in that case, we refer to that as capsular contracture. So the rates of capsular contracture are a little bit higher when you put the implants above the muscle. I do like to put implants above the muscle as well as tissue expanders above the muscle in something called a tuberous breast reconstruction. And that's because in those cases, the lower half of the breast is a little bit underdeveloped. And in order to expand that part of the breast to adequately fit a breast implant and reconstruct the breast, I find it helpful to be able to release those bands from the plane that's above the muscle.
Okay, interesting. Yeah, because they always said it's better, especially younger candidates, to go under for breastfeeding.
Yeah, so the breastfeeding actually is quite successful after breast implants. The two things that affect breastfeeding are the stimulation to the nipple. So when your baby suckles, that stimulation to the nipple causes the milk to be let down. So placing the incisions in the fold and away from the nipple is what I like to do to maximize breastfeeding in that case. And then underneath the muscle, the breast implants are the furthest away from the breast tissue that actually will hold the milk. And so in that sense, breastfeeding is generally very successful.
Okay. And then what about if somebody comes in and they're very small chested and they want to be bigger chested? Obviously the nipple is not going to be in the exact place that it should. Do you guys move them?
So the nipple can be moved,
Oh gosh.
and generally the any procedure that involves a change in position of the nipple is referred to as a breast lift. So in small women, when the nipple's in the right position, you can still do just a breast augmentation or a breast implant, and the nipple usually stays in the correct position. The problems that can't generally be addressed with just an implant when you actually change the nipple position is usually more common in women who have either had weight fluctuations, pregnancy, breastfeeding, gravity, those sorts of things.
Interesting. Yeah, because I remember I was at the gym probably, I don't know, it's probably a year, maybe 2 years after I had them done, and it got a little chilly in the gym, and I was visiting home for the holidays, and my mom goes, "Why are your nipples so high?" I was like, "Because they didn't move them. I mean, they're not that high, but they're a little bit higher than they probably should be." They're very perky when I get cold, if you know what I mean. So let's talk about the breast implant illnesses. I just had a girlfriend who had hers taken out and was sending me all this documentation on how they're making women sick. I actually have two people I know personally that have had them pulled out because they weren't feeling well. Um, how do you know when your implants are making you sick and you need to get them out?
So that's a difficult question. There are a collection of women who are experiencing things like fatigue, brain fog, headache, even autoimmune diseases that feel there is a link between those symptoms and their breast implants. It's really too early for us to know, and there's been no definitive links between those symptoms and breast implants, but certainly a growing concern amongst some women. And so what I always advise women is, if you think your breast implants are causing any of those symptoms, we should remove them.
Mhm.
And so I have a conversation with all of my patients in our consultations about the possibility of breast implant illness, to make sure that they hear that information from me, because patients these days really like to be educated, and patients are reading online. And I like my patients to receive that information, the good and the bad, from me. And so we have a discussion about that during any consultation where someone's considering breast implants. And I think it's logical that, you know, if you think something's causing you illness, it should be removed.
Yeah.
And so that's kind of how I manage the concerns with the breast implant illness.
Yeah, no, that makes sense because I mean, obviously nothing's risk-free, but you just gotta be educated and make that decision kind of, on your own. So what is the typical recovery time now for this surgery as far as like exercising, pain, all that stuff?
Yeah, so breast augmentation is pretty straightforward, actually. I find that many women who come to see me have breast augmentation on a Thursday or a Friday, and they go back to work on the Monday. I use some long-acting numbing medication to help with the rapid recovery process. Usually women just need Tylenol and Advil for pain after surgery.
Oh, wow, okay.
It's pretty common that my patients are feeling up to going out for dinner as soon as the first day post-operatively. I ask that you I ask that they sort of like slow down their exercise routine. So high intensity cardio stuff you can go back to doing at the 2-week mark. And then chest heavy stuff like push-ups or chest presses. I like the patients to take a little bit of a break from for 4 weeks. Women who have kids at home, I think it's safe for them to start lifting their kids at the 1-week mark. And I encourage them before the 1-week mark to do lots of like side cuddles at home, because usually their kids want to be still like close and connected to them. And I find the more they like snuggle up to them, maybe the less they want to be picked up.
Oh, yeah.
Oh, that's always a hard thing to manage. So overall, it's pretty straightforward. The long-acting numbing medication certainly makes a difference. And I think limiting the amount of like pain medication in terms of narcotics and that sort of thing is really helpful to limit the side effect profile. Tylenol and Advil are really well tolerated in terms of their side effect profiles. So if we can manage pain with just that and then the long-acting numbing medication, I find patients recover a lot faster.
Yeah, so it's changed a lot. I remember it was like 3 weeks no cardio, and then it was like I think 3 months before I could like lift my arms.
Yeah, I
Your
actually
work is down the drain.
I have patients start doing some gentle stretches that sort of look like the arms only portion of jumping jacks in the recovery room, actually. So I find that helps prevent stiffness, and also just like helps that encourage them to know like what is within the limits of what's acceptable, because otherwise I find if patients don't do anything, they get really tense, and then they get sore for another reason, because their back muscles and their neck muscles get sore.
Yeah. So how often do they need to be replaced?
So the manufacturer's guidelines say that they last for they're guaranteed to last for 10 years. So what that means is if you have problems with your implants within the first 10 years, the implant companies actually will pay for a replacement of the implant itself. But in all reality, the implants are quite a bit more durable than 10 years. So if you're not having any problems with your implants, there's no need for them to be replaced.
Okay.
The current recommendations are that you should have them imaged regularly, starting at the 5-year mark and then every 3 years, just to make sure that there's no silent problem that you haven't noticed on the outside. And I find many women are coming in with implants that have lasted 15, even 20 years that haven't had problems with them.
What do you mean by imaging, and where can people get imaging?
So the imaging that's recommended is either an MRI or an ultrasound, and that's primarily to look at, bless you.
Like sneezing all of a sudden. Woo! That hasn't happened on a podcast. Okay, go on. MRI.
MRI or ultrasound. And that is primarily to look for, in the silicone implants, a silent rupture. So a silent rupture happens when there's a rupture to the implant, but because it's that gummy bear style, it doesn't spill, you don't necessarily notice.
Right.
So there's many excellent radiologists in the city. I send a lot of the women that I see to one of the female radiologists on the Upper East Side. Her name's Kristen Byrne. She has the ability to do all of the required imaging, and she sees a high portion of women who have breast implants. But there are many radiologists in New York as well that have the ability to provide the imaging.
So does insurance cover this?
Yeah, so she has the ability to get insurance coverage for the monitoring of the implants.
Okay, yeah, because women with breast implants can't do your traditional mammograms, correct?
So they can get mammograms. They do a couple of extra views in addition to the traditional ones. They're called the Eklund views, and those sort of allow for the distribution of tissue in the implant so that they can see the breast tissue a little bit better.
Interesting. Okay,
Yeah.
now let's get into some fun stuff. How is it how is it being a plastic surgeon in New York City? What is your social life like? Can you go out for happy hours, or can you not get surgery? Like, give us some of that. Like, do you have a fabulous life? Like, paint that picture. I want to know that.
Yeah, well, I mean, I think my life is pretty fabulous, but I love what I do. So
Yeah.
that's important because I do spend the majority of my time at work. I also have a young family, so I have two young sons. One's 2 years and one's 10 months.
Oh,
So I spend a
wow.
lot of my time not at work with them. We
Yeah.
explore Central Park and we explore the city. My husband's a corporate lawyer, so he keeps pretty busy hours as well. So we try and keep some family time aside on weekends. We're currently searching for New York's best almond croissant. So we kind of explore the city that way. It's nice to get us out to like the different neighborhoods. That actually began for us, not in New York, but in New England. We were searching for the best clam chowder. And then when I was in New York for my subspecialty training, it became the search for the best pizza.
Yeah.
And now we're sort of on to exploring the city as foodies by pastries. So I would say in general, my work days are pretty full, and sometimes the evenings are a little bit long. But we make some good time for family time, and we're pretty new to the city, so we're very excited to just explore like everything that New York's got to offer. I feel like we're still very much tourists in this city.
Well, that's so much fun though. I mean, like when I first got there, it was it was just your life, right? So you didn't make the time to go and see like kind of the touristy things unless somebody came to visit.
Yeah.
But there's so much to see. It's like now after COVID, when I kind of escaped to Colorado and I'm just going, half New York, half Denver. It's when I go back, I always get so excited because I'm like, now I'm treating it as like, oh, I never went here. I'm gonna go here. I'm gonna do this. I'm gonna do that. Like it's just a different kind of energy. But yeah, it's like you gotta get that in while you can before you're like, yeah, I don't need to go to the Statue of Liberty. I live here.
Totally.
You know?
Totally. the year I was here for my subspecialty training, we kind of made a list of like things that we wanted to do before we left the city, thinking that we might not have the opportunity to come back. And my husband was just saying the other day, we should really make our like top 20 to-do list of things like as if we're leaving, just so that we
Great
really
idea.
optimize the time here, even though I mean we have full intention of staying. It's just a nice way to really optimize the time that you have somewhere.
Oh, absolutely. Yeah, and it's got to be pretty hard raising a family in New York. I mean, it's so expensive and the crime's through the roof. So it's got to be a challenge.
You know, we were pleasantly surprised by how family friendly it is.
Okay,
My
yeah, it
boys,
just depends where your neighborhood is.
yeah, my boys love the like hustle and bustle. They
Oh God,
love like the taxis and the fire trucks and the parks. So we found
yeah.
it's pretty awesome.
Yeah, no, it really is. It's a very special place. But yeah. Well, this is so exciting. Is there anything else you want to add that I didn't address that women should know about this type of surgery? Is this the only type of surgery you do, or do you do other types of plastic surgery?
Yeah, so I joined 19 Plastic Surgery as the cosmetic breast specialist. So I offer a full spectrum of breast surgery, including breast augmentation, breast lift, breast reduction, two-birth breast reconstruction, even doing a little bit of aesthetic reconstruction for some patients who have had previous breast reconstruction for breast cancer, and then breast revision surgery in women who've had problems with their implants. And then in addition to that, you know, women who have concerns with their breasts often have other body contouring concerns as well. So I do a little bit of everything. And primarily the breast is my focus.
Okay, very cool. And so the group that you're working for, they do all types of plastic surgeries?
Yeah, so we focus on everything sort of both neck down. So primarily breast and body procedures.
Okay. What kind
So
of body procedures are people getting implants in their ass?
that's less and less common, but what is very common is something called a BBL. So that's actually using fat transfer to augment the volume in the bum.
So
And
what happens if you lose weight?
so in general, if you lose weight, you can lose volume in the areas where you have had fat grafting, but the fat tends to retain the characteristics of where you took it from. So usually we're harvesting fat from stubborn areas
Okay.
that tend to retain the fat. And so generally the retention is pretty good. Other procedures that we do, we offer like the full mommy makeovers that includes either the full tummy tuck or the mini tuck, and then lipo 360 with a really like sculpted athletic look. Those are some of the most common things that people come to see us for. I work along. I work.
Go ahead. Sorry, what were you saying?
Oh, it's just I work alongside Dr. Nicene and Dr. Funderburg, both who sort of subspecialize in the body sculpting procedures and the mommy makeovers as well. So we sort of, between the three of us, offer the full spectrum of breast and body.
Yeah. And have you guys seen just an upward demand for these procedures, especially with social media?
I guess that's a difficult question for me to answer because I've really had social media as a part of my practice from the time that I was in training until
Yeah.
being in full practice. So I don't really know plastic surgery without social media. But
Okay.
certainly the demand for this type of procedure is high. It's super common. And I would say definitely like with some of the slowdowns that there was on surgery during the pandemic, there's been an uptick in the
Yeah.
amount of procedures that are being done for sure, because elective surgeries for a period of time were put on pause when we
Yeah.
really didn't know what
Oh,
to
yeah.
expect from the pandemic. Mhm.
And then do you mentally evaluate somebody as well? Like there's got to be a case where if let's say a woman comes in and she wants to get these boobs done, like how do you verify that she's doing it for her and not her partner?
That's a good question. I actually very rarely see women with their partners, and that's probably because a lot of the women that I see are super busy. They see me like on a work break during their
Okay.
work day. Um, pardon me. So in general, I haven't had many cases where it seems like she's doing it for external reasons, but
Okay.
that's certainly an important part of the process. In general, the psychological burden of most of these procedures is pretty low because most women
Yeah.
that I see have a very motivated lifestyle. They exercise regularly, they eat well, and there's just one small thing that they wish that aesthetically they could change.
Yeah.
And when it's something safe and something achievable, it's really rewarding, and the psychological burden for them is pretty low to have that addressed surgically. Surgically is a big deal,
Oh
but
yeah.
in general, if you're doing it for the right reasons, the psychological burden can be pretty low.
Yeah, which is good. Yeah, and plastic surgery is so wonderful because if you're doing it for the right reasons, where you just need that little extra confidence boost. I always say if there's something you don't like in your life that you can fix it.
Yeah, totally.
So that goes for your body too, you know. It's your life. You should live it the way you want. You should embrace all that it has to offer. And you know, I'm somebody who's obviously gotten breast implants. And I don't regret it at all. You know, my
Yeah,
ball game's a
absolutely.
little different, but other than that, I'm good.
Totally.
Yeah.
Totally.
Well,
I find,
this has been great. So where can people find you? They want to come see you and all that good stuff.
yeah.
Social.
So, we're located on the 12th floor of the Bergdorf Goodman building, just across from the plaza. So we have a beautiful office, a really iconic location with amazing views of the Central Park. In terms of our practice, we have a pretty active social media profile. So you can feel free to follow the practice online. We've got a big team here and a big family of people all working together. So I find most patients who come in to see me during consultation already kind of like know our team, which is nice. I find a big part of
Yeah.
plastic surgery is actually just choosing the personality that's right for you, because
Yeah.
there's lots of people that have the technical skills to perform surgery, but you want to choose someone who's a good match for you in terms of like a partnership in working towards your aesthetic goals. And that's something that you can see a little glimpse of on social media. So
So what are those handles?
yeah, so my Instagram handle is Anna K. Steve MD. My colleagues are Dr. Neinstein and Dr. Chris Funderburg.
Okay, Niacin is Neinstein. So you guys can quickly find that. Check them out. Check out the website. If you're not in New York and you want to see Dr. Steve, then go and obviously make an excuse to go to New York and go check her out. So
Totally. And even if you can't make the trip, we do lots of virtual consultations. I see probably half my patients virtually. And so if you're interested in eventually a trip to New York, but you just want to do some information finding, we can meet online virtually as well.
okay, perfect. Oh, and my last question that just popped up, because this is a real thing. There's this huge rise in like influencers that have all these followers.
Mm-hmm.
Is it true that some of them get free surgery if they have a big enough following? Like I've
So
heard that. I'm like, what?
so generally, I would say that the most important thing is that you have an organic following of your own. So we really strive to achieve an organic following of people who follow our practice, primarily because they want to know who we are, what we do, and a little bit of maybe education based on the procedures that we do. So my Instagram following is modest so far, but it's growing every day. And I'm finding that actually the primarily the people who come in to see me have already sort of taken a first look on Instagram, and they've seen something that they like there. And so that's been the most important way for me to use social media so far. And
so you don't get people in
following.
there that are like, oh, I'll promote your practice if you give me my surgery for free. I've heard this happens to restaurant people, and they're like, oh, all these influencers want to come in and just like eat for free, and we're like, beat it, nerd. Out.
No, I haven't experienced that type of negotiation so far, but maybe I'm not popular enough yet.
watch, you're gonna text me tomorrow and you're gonna be like, I don't know what you said, but I just had somebody come in. Oh, well, this has been amazing. Thank you so much for taking the time. I know you're probably exhausted from, giving women big boobies.
No, I find plastic surgery is energizing. It's a great career. And if you truly find what you love to do, then you never really work a day in your life. It sounds cliche, but
it does, but it's true. It is the absolute truth. So I encourage everybody to find what they love, but obviously be realistic if you want to make money, because not all passions
that's true.
Income. So I always tell people, because you always have follow your dream. Yeah, but be realistic about your dream. But yes, find something you truly enjoy, so then you don't feel like you're working. So this was great. I'm glad you answered all my questions I had, and yeah, you guys definitely go to the website, check them out, follow Dr. Anna Steve on Instagram. And I'm sure you can reach out to her directly there if you have any other questions that I didn't get to, that I'm sure she'd be happy to answer. And I appreciate you all for listening to another episode of Next to Madison. And we will see you next time to find out who's next.
Hey, your host here, Madison Malloy. Please make sure to subscribe to the show on all podcast platforms, and please rate and review us on iTunes and Spotify. Also, if you have any questions or comments, you can email us at contact@nexttomadison.com. I thank you again for listening. Bye.